Michael, good luck. Biology and medical videos. You can join the group, post interested things, comments, ask questions, and answer questions. Change the graphics settings and diagrams. And then lastly, press the button of subscribing or subscribe. In this video, we'll look at the topic known as laparotomy. Laparotomy. Here we shall look at the introduction of laparotomy. We need a brief introduction. We shall look at the indication. Who needs laparotomy? We shall look at types of laparotomy. We shall look at the complications of laparotomy. Before complication, we are going to look at the preparation. How does the surgeon prepare a patient in the procedure of laparotomy? Then we shall look at the complication, the risks. Complication of this procedure. We shall also look at the management of both hospital and home management. Now, straight away, laparotomy is the type of open surgery of the abdomen. Lapara means open surgery. Of the lower part of the abdomen. That's in brief, which is used to examine the abnormal organs and treats. And provide the treatment. I think that's brief how we can introduce our laparotomy. Being open surgery. Open surgery is one of the major surgeries. Remember, we have minor and major. So this is one of the major surgeries that are done in theaters by medical professionals or the surgeons to examine the diseases and treatments. So in this case, we are looking at laparotomy as the open surgery of the lower part of the abdomen, which is used to examine the abnormal organs and then providing the treatment. Now, away from that, what are the indications? In other words, who needs laparotomy? Who needs this procedure? In this procedure, we look at the people with abnormal pain. We look at people with abnormal trauma. Abdominal trauma or trauma. We look at the people with peritonitis. Peritonitis. Peritonitis is the inflammation of the inner lining of the lower abdomen. Inflammation of the inner lining of the abdomen, of the lower abdomen. We also look at the people with perforated organs. We look at the people with internal bleeding. We look at people with cancer. We look at the people of endometritis. Endometriosis. This is the inflammation of the endometrium. Endometrium is the inner side part. We also look at people with hysterectomy. People want to do hysterectomy. Is the procedure which is used for removal of the cancer. So these are briefly indications among many others that are not mentioned here that requires laparotomy or the abnormal open surgery. From there, we shall also look at the types of laparotomy. We have midline laparotomy or midline. Midline laparotomy. This is the incision or cutting of the lower abdomen that runs down from the middle of the abdomen. Cutting or incision cutting of the lower abdomen that runs in the middle of the abdomen. So they cut you. With the time, we should be explaining this practically using dissectomies. We also have paramedian laparotomy. Is the vertical cut that runs one side of the midline. Vertical cut that runs one side of the midline. Yeah, and this allows the surgeon to access kidneys and adrenal glands. Allow surgeon to access kidney and adrenal gland. So when the surgeon wants to operate you, looking for the kidney and adrenal glands, then should use the paramedian types of incision or paramedian types of open surgery. Then we have fenestel. 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 Surgeon can use this to access the pelvic region, such as in case you have emergency in delivery, like women who undergo C-section. A surgeon use fenestel types of open surgery. Then lastly, we have, second last, we have subcostal laparotomy. Subcostal laparotomy is a diagonal cut across one side of the upper abdomen. It is used to access the gallbladder. This is a cut of upper abdomen which is done diagonally. To access the gallbladder and liver. So when a surgeon want to access your gallbladder and liver, then should use subcostal open surgery. Then lastly, we have rooftop. Rooftop. Now, in the process of subcostal, there is a meeting of the line or the meeting of the cuts. Now, the meeting point of that cut where the surgeon has done diagonally is known as the rooftop open surgery. So it's the meeting point of the subcostal, but also it's used to access, a surgeon use this to access the liver and the gallbladder. Hope this will make sense. Thank you.